Hi, everybody, and welcome to this FP Insider conference call. I'm Jonathan Tepperman, Editor-in-Chief of Foreign Policy. Today, we're going to be talking about how the many ways that cities are leading the fight against the coronavirus pandemic, and about the experiences of two of the world's richest and most globalized cities, namely New York and Singapore in particular. Before we get started, let me explain how the call is going to work. In a few seconds, I'm going to introduce our two guests and then ask them a few questions myself. We'll have a little conversation, and then after a few more minutes, I'm going to start bringing in questions from all of you, our audience. Now, how you ask a question depends on how you've connected with us. For those of you who have logged in via Zoom, and I know we're all living our entire lives via Zoom these days, just hit the Q&A button at the bottom of your screen and type your question in the little box that pops up. If you've called us by phone, you can also ask questions. Just do that by emailing them to web@foreignpolicy.com. That's web@foreignpolicy.com. And in either case, when you do ask a question, be sure to tell us your first name, the organization at which you work, and your location, the city and country you're calling from. And you can feel free to submit questions at any time, starting pretty much now. Okay, here we go, let's get started. We're very lucky to have two superb guests with us today. K. Shanmugam is Singapore's Minister for Home Affairs, and he gets special credit because it's currently 11 o'clock at night in Singapore. So thank you for joining us. Dan Doctoroff, is the CEO of Sidewalk Labs, but even more important for our purposes, he was Deputy Mayor of New York City in the Bloomberg administration, and he spearheaded the city's redevelopment after September 11th, 2001. Minister Dan, thank you so much for joining this call. Please unmute your devices and we'll start our conversation.
Great, thanks for having us.
Absolutely. So, Minister, hi, welcome. I want to start with you because of the recent dramatic events in Singapore. Last month, despite your city's very close ties with China, economically, culturally, geographically, Singapore was nonetheless being touted as this great coronavirus success story. But then came this huge outbreak among migrant workers. And now Singapore is one of the hardest hit countries in all of Southeast Asia. So what was going right, and then what went wrong?
Okay, if you looked at it until the 9th of April, John, we had about 1,200 cases. If you look at it on the 30th of April, 3 weeks later, we're looking at about 15,000 cases. Why has it happened? Primarily, outbreak in our foreign worker dormitories. We have about 1.2 million guest workers, of whom about 200,000 are in purpose-built dorms. The government regulates and sets out what the standards ought to be, purpose-built dorms. Another about 300,000 are in private residences. Again, the government says how many can stay, maximum, 6 to a residence. And another 100,000 or so stay in what we call factory converted dorms. Again, there are rules governing how many there can be and what sort of facilities there ought to be. Our own analysis is that you have 8 to 12 men in a room, bunk beds, and the dorms, we have about 43 purpose-built dorms and several other types of dorms. They live together, they eat together, it's communal living, they cook together, and they go from the different dormitories to work sites where they mix in literally, and then on the weekends, you could have 50, 100,000 of them gathering in specific places. So you can see the possibilities of how the virus travels. And so that has led to a substantial increase in the numbers. John, to put it in perspective, I'll put it like this. You have to look at these dormitories as floating ships. They are ships on dry land. So you go back to the USS Roosevelt. You had 4,500 sailors. Within about 3 to 4 weeks, you had about a fifth of them right? 950 or so sailors affected. Because that's what communal living does to you. Or you take the Diamond Princess. Again, nearly 19-20% of them were infected. So that's what's happening in the dormitories. But the second thing that's happening when we look at these numbers, I tell people you need to assess the numbers and draw the right conclusions. We are testing about 3,000 foreign workers per day. We were testing about 3,000 foreign workers per day for, say, a dormitory population of 200,000. The US was testing maybe 150 to 200,000 per day for a population of 300 million. So the intensity of testing is about 10 times that of the US, and much more than any other country in Southeast Asia or anywhere else. And we want to go in there. And a large number of cases, up to 50-60%, are asymptomatic. Most countries wait for the cases to turn up, people to call in sick. A lot of people out there don't feel the symptoms. We are going in to pick them up, even when they are completely asymptomatic. So the numbers reflect tests and asymptomatic cases. If I were to put it in another way, the governor of New York sort of estimated that while the official numbers for New York City are 300,000, he estimated that up to a quarter could be infected. So all of our numbers doesn't reflect the actual number of people infected. It's just a question of what you have found.
Sure. Sorry, understood. But to stick with your metaphor, just as the Diamond Princess and the U.S. Navy have been criticized for not moving more quickly to get their people out of such a confined situation, questions have been raised about whether Singapore should have moved quicker to address the situation in the dorms. In retrospect, do you think there are things you should have done earlier?
We will review, what we did and how it impacted. I would say this, though, that I think, if you have Singapore's population densities at about 8,000 per, slightly more than 8,000 per square kilometers. I mean, for comparison, Washington is at about 4,000 and New York City is at about 11,000 per square kilometers. So when you talk about an urban environment, a few 100,000 guest workers living in purpose-built dorms, where do you move them to? It's communal living. And even now, when we've put in very strict measures and rules, and when you close off one area of a dorm and you're giving them medical attention, we are finding that it's spreading across that floor to other rooms when actually there shouldn't have been any contact. So I think the reality is when you have a lot of men living in communal living in specific dormitory style, you're going to find it very difficult to stop the spread.
Dan, I want to bring you into the conversation. I live in Brooklyn. I think you're in Manhattan. The situation here in New York just a couple of weeks ago was very scary, with hospitals overcrowded. The rest of us living with the very real possibility that if we needed emergency medical help, we wouldn't be able to get it. Cases climbing. Now we seem to have turned a corner. The hospital situation has improved. The overall infection rate and the pace of deaths have both declined. Is it too soon to say that New York has turned a corner and that the city has got its response right?
Yeah, I think what you can say is the city certainly has turned a corner for now. I think what you also have to recognize is that for now is an important qualifier, that we have to listen to the scientists and the data analysts to guide us in our decisions from here about how we gradually kind of reopen things, because I think everyone recognizes that if we aren't vigilant And if we don't follow the science, there's a real risk that we could begin to see cases spike again. In addition, inevitably, as we do open things up, there will be that risk. We have to have both testing and tracing and quarantining in place regimes in really high functioning state in order to keep the numbers low. So, I don't think there's a whole lot of dispute about that. It's all going to be in terms of the execution. And, to some extent, that execution really is a function of leadership. I do think in New York, with New York State, with Governor Cuomo in particular, particularly since the outbreak began, he has been an exemplar of excellent leadership because he's communicated clearly, he's been honest, he hasn't speculated about things that he doesn't know, or if he is speculating, he's very clear about it. And he has taken a very thoughtful approach to shutting things down. And I assume he'll take the same approach to opening things back up.
Now, one of the key differences between New York and Singapore is that Singapore isn't just a city, it's also a country, and it has national powers that New York City doesn't have, like it can close its borders and can control the flow of people into the city. Whereas here, we're really living through a moment that highlights the problems with our incredibly messy federal system. Namely, we now have this total patchwork of lockdown regime around the country, with cities, states like Georgia and Texas, and Florida and others starting to open up. Does that pose a real risk to New York City? And what can New York do about it if it's just a city?
It absolutely poses a massive risk. Sort of the failure of national leadership and coordinated national leadership poses an enormous risk for New York, but for everywhere, because at the end of the day, we can do a spectacular job of, gradually opening things up, having that be combined with extensive testing, tracing, which, by the way, I think we are finally starting to really get our arms around that, thanks to the Bloomberg philanthropies and Governor Cuomo. But if people keep coming in and the numbers get big, the process of actually managing it becomes too complicated. It's essentially a data problem and a management of large numbers problem. And so that's the biggest risk that we have, is failure of coordinated national leadership.
So speaking of national leadership, you joined the Bloomberg administration shortly after September 11th, 2001. And one of the Bloomberg administration's key takeaways from that crisis, this is something that I wrote about in a book chapter I did on New York City after 9/11, which is when you and I first met. One of the administration's key takeaways was that it couldn't rely on other levels of government to keep it safe. And that it had to take care of matters on its own. And that meant, among other things, taking on all kinds of jobs that had never been done at the municipal level, such as effectively national security on a city level. Has something similar happened in this crisis? Has New York City again been forced to take on all kinds of new roles, or should it?
Yeah, look, it has to do what it can do, particularly in the face of a lack of coordinated national leadership. And I think to some extent we've actually seen that. But, look, we still do rely on the federal government. And even in the wake of 9/11, we relied on the federal government. We got $20 billion from the federal government to recover after 9/11. We still relied on a variety of government agencies. Yeah, we created a security team, counterterrorism team in the police department with 1,200 people. We exerted, I think, great leadership in demonstrating to lots of people in lots of different ways that the city was safe. We will do those things in this case clearly to the extent we can. But because 9/11 was so isolated, we could be more self-reliant. In this case, this is a global problem and requires kind of people who are kind of way above the city's kind of level to participate and help address the issues. You can't do it alone. You can do a lot, but you cannot do it alone.
That said, you work for a technology company that works with cities. One of the themes of Bloomberg, the Bloomberg administration and Bloomberg Philanthropies since the mayor left office, which I know you're involved with, is helping cities coordinate to address some of these problems on their own, again, because they're the last line of defense. Do you see that happening here?
Yeah, it's already starting to happen. So as I mentioned just before, if you look at the state of New York's contact tracing effort, it is being assisted by Bloomberg Philanthropies. There's a great role for philanthropy to play. Tom Frieden, who was our commissioner of the Department of Health and then went on to become the Obama administration's head of the CDC, is basically leading that effort and has galvanized a whole set of resources to be able to really lead the nation in effective contact tracing. And for those of you who don't know, it's once somebody has been identified as having coronavirus, they then, trying to understand everyone that they have talked to or been in contact with, and then identifying sort of whether they need to be tested or potentially, if they test positive, quarantined. So, it is, there is a role for technology to play. There's a role for philanthropy to play. At the end of the day, it still has to be led by government. This is too big a problem for the private sector or philanthropy or any local government to actually deal with on its own.
We're starting to get a lot of questions from listeners, so I'm going to bring in some now. Jonah Marsh, who is a student at University College London, but is calling us from Hamburg, Germany, has a question for you, Minister Shanmugam. He wonders how Singapore's previous experience with epidemics like SARS prepared the city for this pandemic, and whether coronavirus is presenting new challenges that weren't anticipated because of the differences between this disease and those previous ones.
I think the answer to both questions is yes. We learned a fair bit from SARS, set up a specific center for infectious diseases, trained our people, sort of went through the playbook on what we can do. But sometimes you can learn it too well. I mean, this virus is different from SARS. It's far more infectious. It's not as fatal if you take proper precautions, but it is far more infectious. So, that is something that we saw happening around the world. And so we had to prepare ourselves and change some of the things that we were doing. So medically, I would say we were well prepared. And that sort of, and this is going to be a long fight, by the way. So whatever I say today could turn out to be wrong in a week or 2 weeks or a month. But I think so far, if your healthcare system is not overwhelmed, and that's the key. In any setting, you've got to make sure that your healthcare system has the capacity and your healthcare workers are properly supported to stay ahead, well ahead of the number of cases coming in. If you do that, you can keep your mortality rate low and you can protect your senior citizens who seem to be most at risk. You look at Germany and you compare the German rates with everybody else, or in Singapore, for the number of cases, we have had 15 people dead so far who have died of this coronavirus. So our healthcare system has been able to cope, and that is something we keep a very close watch on.
I have a question from Paul Duncan with Dripshot, and this is really one you can both take. And that's about technology. Dan, this is something that you've been involved with for a long time. Minister, I know this is one of the areas in which Singapore leads the way. And the question is, how much can high-tech solutions make a difference in this case. We've all read a lot about the sophisticated apps, I should say, that South Korea is using very effectively, for example, and about the high-tech solutions that Israel and other states are trying. So how much of the answer is it in Singapore and New York? And do you think there's more room to use tech than we're seeing?
Well, certainly a lot more room than we've used, say, to use it than we've used in the United States thus far, or else we wouldn't be in the predicament we're in now. And the experience of other countries, whether that is Singapore or South Korea or Germany or Sweden or whatever, prove that. The approach to managing a pandemic is not new, right? We've known it since the Middle Ages that it is identify people who are sick, identify the people that they've been in contact, and separate them. I mean, that is basically the playbook that's been in existence for now probably since the 16th century or so. The question is, what are the tools to be able to do that? And we do have infinitely better tools than we did, and we've demonstrated that in lots of places around the world. They can get better. I think one of the things we have to be sensitive about is many of those tools implicate real privacy concerns. And the debate between privacy and that invasion of privacy in order to achieve a societal objective is something that we've never actually had. I think we're going to need to have that now. That, again, needs to be led by government. But I believe at the end of the day that in the case of something like this, as long as it is specific and limited, we can clearly get over that and use the tools that we have to our advantage to really, really pinpoint sort of the problem and deal with it as effectively as we can.
Minister, I want you to come in on this and address not just the tech side, please, but also this question, this very important one of the trade-off between privacy and civil liberties and public health, which is especially interesting in this conversation because the way Singapore has answered some of those questions historically has been different from the way the United States has.
Yes. First, I agree with Dan on what he had said on the use of technology. Look, we can't all be in a state of suspended animation, right? All staying in our rooms. If you don't die of the virus, you're going to die of the economic stagnation. The economy is already deeply hurt and it can't carry on. So you've got to open up. But we all know the risk of opening up is significant. I mean, you've talked about it in the context of New York. We all face those risks. And you already see in China, while they managed to control it, every day now they're getting about 20 or so cases. And several of them, more than 50%, are completely asymptomatic. So that tells you what the risk is. So you need to open up, but you need to open up in a controlled way. And the answer is in tracing technology and testing, which is also technology. Massive testing, massive tracing. And anytime you find somebody, you better pull the person out. You better alert everyone else who has had contact with that person. That's the only way you can give confidence until you get an effective vaccine, right? Which is not there on the horizon yet. How do you manage that vis-a-vis privacy issues? I think we will be able to explain to the population, look, there are individual rights of privacy, but if you don't take care and if you cannot actively contact trace, effectively contact trace, what are you doing? You're doing a number of things. One, the healthcare worker who has got to take care of you is at risk. You're putting other people at risk. You are potentially overwhelming the healthcare system. You are possibly denying proper medical care for others who may have been more responsible than you have been. So you weigh all of this. I think it comes down on the side of contact tracing, probably with a kind of app that resides in your phone, and that can be called up, not in some central database, though I would say France has a sort of central database, and so have other countries, but something that resides on your app so that we can pull it up and call everybody else up. I think this is one of those situations where I think people will be prepared if it's properly explained that the healthcare concerns are significant and should take priority.
Yeah, I mean, we've seen pretty clearly in lots of different situations in which privacy is implicated that the most important thing is to do the minimum necessary to invade people's privacy, to be very clear, transparent about how data is being used, and ultimately to ensure and make the case, as the minister just said, that the benefits significantly outweigh the costs. And as long as we're honest about that in this case, I have no doubt that it shouldn't be an insurmountable problem. But if we don't pay attention to it and we just kind of blithely ignore it, then we will start running into problems.
I want to bring in two more.
Comment. Sorry, can I add a cheeky comment? There is nothing that any app like this would find that your tech platforms don't already know about you.
Oh, that's absolutely right. And I mean, what that reveals is that we're just how overdue we are for a proper conversation about privacy in the United States, because these issues have been raised for a long time and the country has still not tackled them. I have two reader questions or audience questions here, excuse me, that I want to read together because they're linked and you'll see how. The first is from Nick Bradshaw at the World Innovation Summit for Health in Doha, Qatar. And he asks, how will the whole concept of what a well-functioning city looks like in terms of its infrastructure, such as public transport, et cetera, how will that have to change as a result of this pandemic? And the second question comes from Robert Enteen, who's a retired health research scientist and a medical journalist and an NPR medical talk show host, and he's participating from California. His question is, the infectious disease literature suggests that animal transmitted diseases will arise more frequently in the future. So it follows that pandemics and mass quarantines will also occur more frequently. What should cities do to optimize their ongoing preparedness to prevent or control diseases? So the two questions are getting at the same underlying question, which is, how do cities have to change going forward so that we can better protect ourselves?
So I'm happy to take particularly the first question. I can't speak to the frequency of animal to human transmissions, but I can speak to what cities need to do to recover and then think differently about kind of how they function in the future. The first thing I would say is I would caution against immediate overreactions in terms of there's necessarily going to be massive changes to cities. My experience sort of after each crisis, certainly that I've lived through, the predictions of kind of what would happen have often turned out to be wrong. And so we do need time to process kind of the impacts, both psychological, economic, societally more broadly, before we can begin to really think about how a high functioning city should function. I do believe that foundationally for cities to recover and then think about how they change out of the coronavirus pandemic, each city has to adopt an approach that says it will attempt to be a leader in public health. And that goes to the whole question of hygiene, and some of that has to be symbolic, some of that has to be truly substantive. For example, in New York, the lifeblood of New York City is the subway system. If we aren't quite visible in demonstrating that the subways are safe, and that might mean hiring thousands of people to literally wipe them down during the day, not just at night, we won't build the confidence for people to actually return. We're going to have to invest in preparedness in a way that a city never had been before, and that has to be very clear. And whether that is buying equipment and stockpiling it in a way that we never would have before, thinking of it as just a capital expense that's necessary for the future health both physically and financially of the city, that's going to be critical. We're going to have to demonstrate that we actually care for people who otherwise might not be cared for by connecting them in new ways. And a lot of that will involve technology. So foundational for any recovery of any type, public health is absolutely critical. Then the question is, what kind of city do you actually become? What have we learned out of this? And, I think even before the pandemic, what we certainly saw in New York and many other cities is that citizens were demanding a different model. They believe that it's important to grow, but they want that growth to be distributed in a fair, more inclusive way. And I think it's less about sort of the pandemic, although the pandemic really illustrates how, in some ways, we've gotten away from caring for each other in an effective way. Citizens are going to demand that. And so a new growth model, an inclusive, sustainable, resilient growth model is going to have to be developed. And there is, I think, certainly no city in the United States, or maybe even in Western Europe, I think, that has kind of really developed that model. I think innovation can help us to do that, but we're going to have to reprioritize in order to really satisfy the absolute requirement for greater fairness in our cities.
Well, let me, Minister, before I come to you, I want to follow up with that thought, Dan, because one of the most striking things the Bloomberg administration did when you were at EDC was use the crisis as an opportunity to reinvent the whole city and fix all of these longstanding problems that were not necessarily implicated in the crisis itself, but that the crisis created opening to address, whether it was your green growth initiative or your STEM initiative, et cetera. Do you see something similar potential here?
I absolutely do. We've all heard the expression, a crisis is a terrible thing to waste. I think that's true here. After 9/11, as you said, we took the opportunity to rethink sort of the city and prepare the economy to really compete in the 21st century. That's not to say we did everything right. And as I said, to some extent, the growth model that we deployed in some ways worked too well. We drew too many people and didn't do enough to accommodate that growth. So we saw dislocations, particularly with respect to affordability. So we know these problems exist, right? We know the public is demanding a different model. We saw that play out in, for example, the rejection of Amazon here, where fears of gentrification, the lack of public participation, the distribution of economic opportunity, the affordability issues writ large played a role in defeating something that could have been managed in a very different way and should have been an engine of growth and distribution of resources in a fairer way. But we weren't ready for that. We have to be ready for it now. And so we've got to develop a plan. I would describe it as sort of an inclusive, sustainable, resilient growth plan, because growth is critical. If we don't grow, you basically can't generate the resources to pay to be progressive. If you're not prosperous, you can't be progressive, but you've got to do it in a different way. And I think this is an opportunity right now with great leadership to galvanize people behind this crisis and seize on it to develop that new model. I think back again to 9/11, Rudy Giuliani, and lots of people have lots of criticisms of him, which are fair, but his leadership literally was great, particularly on the day of 9/11, where he said, we're going to rebuild this city. We're going to make it greater than ever. And that galvanized people to actually do things they otherwise wouldn't have done. I think that opportunity exists right now, not just in New York, but in other cities as well.
Minister, let's bring you in on this question of how cities are going to have to adapt and change, including in their physical infrastructure and transportation, et cetera. And there are two more reader questions, audience questions that address this, which I'm going to mention. Niall Cronin from London asks, will we see a shift in transportation priorities as working from home becomes a new normal? And Avi Love asks, what will be the impact on retail and work becoming virtual, how will that all affect the shape of cities to come?
Well, John, let me try and take them together, as it were. You know, modern cities, if you want to be successful, you can't be cut off, right? You've got to be interconnected with the world. I mean, can you imagine New York City not being connected with the rest of the US or the rest of the world? It calls itself the financial capital of the world. It is because it's also connected. Likewise, Singapore's raison d'etre is connectivity. That connectivity is also bringing in the risks. So you can't say, I'm going to cut myself off. You've got to say, how do I manage the risks? So we talked about it, technology. I'm essentially an optimist. I think cities will cope. We are all resilient cities. If not, you will go the way of cities that didn't survive. And what does it require? I think it's going to require, we talked about it, a leadership that the people trust. That's a starting point. A leadership that says, look, we can get this done. And we are going to fight this. And a population that's prepared to come together and work with the leadership to have it sorted out. And with that trust, in the medium term, before we see any kind of antiviral or vaccine, what I see is a series of measures for safe distancing. People will go to work, but you will have QR codes everywhere. You will, if anything happens to you or you fall sick, people will know where you have been, who has been in contact with you. At workplaces, you have to become less social. You see images from South Korea where during lunch, people sort of have their lunch in their own sort of bubbles. You will have some of this, I think, for a while, but that militates against the essential human nature of being social. So we'll, I think, get back to trying to be social as soon as the technology and the medical technology allows us. In terms of the questions on whether it's going to shift in transportation priorities, again, in the medium term, I see more staggered working. I see more people trying to work from home. But in the end, you also need the workplace to come together. It probably accelerates some of the stuff that's been happening, right? Whether it's in real estate or whether it's in retail. I think this has come as a huge imperative to do things in a very different way. And so it has given a huge push towards using technology and traveling less. It probably will have implications for international travel too. But in the end, we are all social beings. We want to come together, we want to meet. And that's what a great city is about as well.
Yeah, I suspect that sort of once we've passed this point where we have a vaccine or therapies that meaningfully reduce the risk, the changes will not be as dramatic as people think right now. But that doesn't mean that there won't be changes. I agree with the minister. The desire to be together is a fundamental human instinct, and that will drive things. I'll give you a funny incident. When I was at Bloomberg, I was CEO of Bloomberg, and I said, let's put cameras on everybody's desks so we could save money on travel costs. And so we did. And one interesting thing happened, which is people communicated with each other a lot more than they would have. They made connections that they wouldn't have made because they could actually see each other. And this is now maybe 8 years ago. But another interesting thing happened was travel actually went up because once they saw each other, they felt a real need to be together. And that just, I think, illustrates the powerful kind of need to be together. The other thing I think that's important, particularly as you think about mobility and retail, they were changing anyway. There are all sorts of new approaches to mobility, in part driven by the future with autonomous vehicles. They're going to change the way we actually commute in cities. The whole notion of last mile kind of travel was changing already. The same thing was happening in retail, where the rise of e-commerce was already kind of undermining department stores and other kind of more traditional retailers. So does that mean that retail will die? No, it means that it will adjust. We're already starting to see e-tailers have physical presence, but because they're newer, they're not going to want longer term leases. Well, without longer term leases, how does a developer actually manage that? Well, they have to build more flexible space. Well, there's new technology to be able to do that, to be able to knock down walls in easier to easier ways so that you don't have wiring in the walls. So all these things are interconnected. They've all been happening. And I suspect what we will see is some acceleration, but not sort of a completely fundamental shift in the way we live in cities.
You both mentioned travel, and we have a reader question that relates to that from Bua Koitong at the Kellogg School of Management. And the question is, we've already seen leaders around the world using the pandemic to tamp down on immigration, especially Donald Trump. Both Singapore and New York in the United States rely a lot on immigrants. And do you see the pandemic negatively impacting the city's ability to get the immigrants that they need to fuel their growth?
I do. I think that's going to be a huge risk in the short term. We've already obviously seen it with the Trump administration. You know, if you look at New York is 40% today, people born outside the United States. I think 2/3 of the people who live in New York were either born outside the United States or have a parent who was born outside of the United States. We are totally dependent upon immigration, not just for our growth, but to a large extent for the energy and creativity, the openness that is New York's unique competitive advantage. And if that tap really starts to slow, that would represent a significant problem for New York City. So yeah, I think it's a real risk, and hopefully one that that will be addressed in November.
Minister, let me ask you this question from Aflatun Kaiser. What do you think the most important lesson for big cities in South Asia from this whole experience with coronavirus is? What will be the key takeaway going forward?
Did you say Southeast Asia? Big cities in Southeast Asia?
Yeah.
All right. The big takeaway for this is going to be that, you know, these risks are going to be with us, number one. I'm not an expert, but can you rule out another major virus or pandemic breaking out? So number one. So two, so you better be prepared, absolutely prepared, which means putting in the right level of resources into the healthcare system and healthcare workforce to be able to react. And a specific challenge for Singapore, as opposed to other cities, which have a hinterland, is that city, it's also a country. And so how do you create spaces? It's a big urban challenge, which our Ministry of National Development sort of sorted out fairly quickly. How do you make sure, I mean, just take this virus, for example. After you swab somebody, you need to keep them in isolation until you know what the test results are. If they show to be positive, but are not that ill, you need to isolate them as well. Supposing it's in the thousands, you need places for them. And then after a certain number of days, usually 14 in the hospital, they can go down to step-down care. How do you create that suddenly in a place that's 760 square kilometers, right? And how do you create facilities for quarantining people? How do you make sure that people can stay at home and not come out? What are the logistical challenges? So you have a whole series of challenges to keep a city going during a period when you have cut back on and have asked people to stay at home, ranging from a lockdown to, in our case, not quite a lockdown, but a circuit breaker where maybe 15, 20% of the population is working and the rest are expected to stay at home by law. Severe challenges, and then you come out of it for a period. You need to be safe. I think the logistics, the management, the ability to keep faith with the people, make sure that they have the necessary resources to see it through, in terms of the economics and the money you put on the table to help people and businesses. Lots of things for people to think through.
I would echo the focus on preparedness. And the second thing is listen to the experts. You look at different places around the world, and the reliance on the science and data, to the extent that we've had it, to a large extent determine the success with which different places have had dealing with this crisis. So it's not, it's hard to do. Sometimes it requires extraordinary political will and leadership. But if we're well prepared and we listen to the science and take action at appropriate times, the crisis becomes less severe than it otherwise would be.
Well, on that note, I'm afraid we have to wrap up. You've both been generous with your time. You're both busy people at the best of circumstances, incredibly busy right now. And besides that, the minister needs to get to bed so he can go to work tomorrow morning. I want to thank you very much for your fascinating thoughts. I want to tell our audience that a recording of this webinar will be available shortly on foreignpolicy.com/live. And to make a plug for your FP Insider subscription, which includes more of these conference calls and also access to things like the special reports produced by our analytics team, such as a deep dive into 5G and a new research report on global climate security threats. I'm Jonathan Tepperman. Thank you all so much. We'll speak again soon. Be well.